Welcome everybody to our May public training for the NEMSIS Technical Assistance Center. My name is Julianne Ehlers. I'm the Program Director for the NEMSIS TAC. Today we're going to talk just for a little bit about using EMS data for traffic safety initiatives. I think our group will be manageable enough for this session that if you want to stop me during the discussion and ask a question, please do. There will be time at the end for questions, but the purpose of this public training is for you to walk out of this training having a better understanding of how to, what EMS data are available for traffic safety initiatives, how to access that data, how to make it communicate the story that you are trying to explain to either your staff, your administrators, the decision makers in your jurisdiction, or even on a grant application. There's so much great information available, but it's sometimes difficult to figure out and to decipher how to get to the right data and how to make it actionable for what you are looking for. All right, I guess I should share my screen. That'd be a good way to start it all. Please feel free to use chat. Lori Lundy with the NEMSIS TAC will watch chat for us and interrupt me if I'm not able to catch it. It's hard to see in Zoom, the chat and the presentation and the people. So Lori's going to be my assistant on that today. Also, feel free to come off mute if you would like to ask a question. We are happy to work through any questions that you've got. All right, so using EMS data for traffic safety initiatives. Let me move one more thing over. We will spend a few minutes today going over briefly NEMSIS and the flow of EMS data. Most of you on this call will have a lot of experience with NEMSIS and with EMS data, but I know we have some additional participants that this isn't the normal world that they operate in. They are clinicians that operate in the data collection side of it. So we're just going to spend a minute talking about how that all fits together in the big picture. We'll talk a little bit about the National Roadway Safety Strategy. That's from the Department of Transportation. A little bit on the EMS data standard. We'll introduce a post-crash care suite of resources, MVC-related injuries, some support for grant applications, and then how to get to all of this great data that we're talking about. So this, we'll spend a couple of slides just doing a level set. For those of you who may not be as familiar with the flow of EMS data, this graphic just gives you a little bit of an insight into how far that patient care report or PCR data travels after it's collected in the field. You can see, I hope you can see my cursor, but the ePCR, the electronic patient care report, captures a wide range of data from that dispatch data generated to on-scene data that's inputted by the field clinicians. They input data on the care that's provided, the response characteristics about the ambulance, the service, the clinicians. And then it also includes some emergency department and then the closure data or wrapping up that information on the PCR. But after all of that's collected, EMS data is often shared with agencies from the hospital. Maybe hopefully they're getting EMS outcome data back to the agency. A lot of hospitals participate in the National Trauma Database, so those trauma records are shared there. There are lots of other registries that the EMS data are shared with. And then as it gets submitted to the National EMS Repository, that is also shared with federal and national agencies like the Office of National Drug Control Policy, ONDCP, the CDC, HHS, DHS. We work with a lot of federal partners in helping them understand that pre-hospital medical care part of the healthcare continuum. NEMSIS is the National EMS Information System. We, as an organization, we collect EMS data, we clean it, we store it or warehouse it, and then we share it back out. NEMSIS helps to quantify that EMS response. And I need to change something really quick here. NEMSIS helps to quantify that, the data that's collected for EMS response, that pre-hospital patient care. The data is often used to measure performance, support quality improvement programs. NEMSIS provides a uniform data standard and data resources to help facilitate that system improvement, growth in EMS research, which is so essential to the evidence-based emergency medical care. The core components of NEMSIS, so what our mission critical areas are for the National EMS Information System, is the documentation standard. First and foremost, that standard provides a structure for EMS data collection. We provide data definitions for point of care. We provide compliance testing for all of our EMS patient care report software developers. We support interoperability for that data exchange and data exchange standards. And then, of course, we house and share the National EMS database. So NEMSIS is fully funded by the National Office of EMS through the Department of Transportation. NHTSA, National Highway Traffic Safety Administration, their Office of EMS, their mission for OEMS is to reduce death and disability on our roadways, provide leadership and coordination, and also to assess, plan, and develop and promote that comprehensive evidence-based EMS and 911 systems. OEMS works with state offices of EMS. They work with 911 PSAT providers and state transportation officials to promote and support the improvement of post-crash care on our roadways and to support better 911 and EMS systems in communication, precise location, that ability to deliver pre-hospital emergency medical care at the right time and at the right place. So some of you are familiar with the National Roadway Safety Strategy. This was released last year by the Department of Transportation, and it just focuses on addressing the 5 elements of the safe system approach: safer people, safer vehicles, safer speeds, roads, and post-crash care. We'll zero in on that post-crash care part of this. For this discussion, post-crash care has a very specific goal, and that is to enhance the survivability of crashes through expedient access to emergency medical care while creating a safe working environment for first responders and preventing secondary crashes through that robust traffic incident management system. The quote here, between 2011 and 2020, over 370,000 people died in transportation incidents in the U.S., and more than 94% of that occurred on our roads. So the post-crash care really zeroes in on how to reduce the fatalities that we're seeing, the fatalities and the serious injuries that we're seeing on our roadways. Key actions for NHTSA's post-crash care, of course, EMS on-scene safety. We're seeing a lot of interest and news about how dangerous the roadways are for first responders. Traffic incident management, expand the use and support for NEMSIS and the collection of quality EMS data, and then improve the delivery of EMS throughout the nation. So we've introduced NEMSIS a little bit. We've talked about post-crash care, the National Roadway Safety Strategy. To level set a little bit further, we have all 50 states. We've got 50 states, the District of Columbia, and 3 territories who voluntarily submit their EMS data to the National EMS Data Repository. States and agencies work really hard to collect good data from field responses and to submit that from the field to their region in some cases, or to their state. And then the state works very closely with their PCR vendors and with the NEMSIS tech to make sure all of that data gets reported to the National EMS Repository. We're looking at, for last year, we're looking at about 51 million records submitted for 2022. So it's an enormous amount of data that's being shared from every state. And we're gonna show you how to get to some of that data as well. The National EMS Data Standard, as we think about the standard, it really provides structure, as I said earlier. It provides that consistency in terminology and definitions and reporting, and it creates this level playing field for documentation, for analysis, integration into the patient's healthcare record, measuring performance, providing the ability for EMS to be assessed across the nation. The standard, the EMS data standard, is developed with key stakeholders from all aspects of the EMS industry. And with those stakeholders, we establish the minimum required data elements to be collected. And then a state and then local agencies can also add what data elements they want collected for their specific needs. So if you're a field clinician and you're looking at that entire patient care report and all of the required or mandatory fields as you're doing that documentation, some of those are national elements that are required to be submitted to NEMSIS. Some of those are state specific, that the state has targeted initiatives or very specific reasons that they're collecting data that is unique to the needs of that area. And then some of the elements that you're collecting in your PCR are identified or required by the agency level. Maybe they're involved in a trial or a clinical study or a research project. Maybe there are specific initiatives to the jurisdiction that you're working within that is requiring or is needing specific insights into that EMS response. So as you look at
Can I interrupt real quick,
yes.
Julianne, with a question?
Please.
We had a question on the previous slide about the 2017 dip in records, what that was due to.
Yeah, that's a great question. I'm going to go back and show you what she's talking about. Okay, so this 2017 dip in records here. As we talked about the data standard goes through different versions. Many of you are experiencing right now implementing version 3.5 with your agencies, your vendors, and your states. Well, in 2017, we transitioned from version 3 to 3.4. And this was actually, I'm going to correct myself. We transitioned from version 2 to version 3. And this was a significant change in how the data were being collected and what data were being collected. So when we shifted from one data standard to another, it took a good year for vendors to develop products and then roll out training for agencies to learn the new documentation system, and then for states to support data submission in the different standard. So that dip is shifting from one data standard to another, as it can be a big lift as you are adjusting not just how data is collected, but what the terminology, the definitions, the required elements. And then over the last 6 years too, we've seen a big shift in the reduction of paper documentation. And that's a big shift for an agency as well. If they're used to documenting their EMS calls on paper and then having to learn an electronic system. There are probably many on this call who have been doing this long enough that you remember and think fondly upon how simple your paper reports were, and then how electronic documentation gets a little bit more complicated, but the resource that it provides and that addition to patient care is quite valuable. Good question, thank you. So as we think about all of that good EMS data, okay, we've got NEMSIS, we've got Office of EMS, we've got all the states and territories participating, we've got thousands of clinicians in the field documenting their patient care reports. One of the really important things about having a data standard and having that consistency, and also being able to move the data electronically. This visual just demonstrates a little bit how the patient care report gets populated. Either, sometimes that's information directly populated from CAD, from dispatch or the PSAP, the 911 center. Sometimes that's data captured directly from a medical device into the patient care report. A lot of it is hand entered by the clinician in the field doing the patient care. All of that information populates that patient care report and it gets sent to the state. The state collects a big set of the data that is generated in the field, and then that state submits it to NEMSIS, and they submit just a little bit smaller data set than what they've collected. We tested this process in the field with the 3.4 data standard, and this was able to be completed from closing a record in a living room to having it populate in the national EMS database in as few as 7 minutes. So I imagine if we were to test it again, that may be even less time now as the robust products that are being developed by software vendors have really expedited some of that data sharing. So it moves fast. It is an incredibly timely data set that has the potential to provide really critical situational assessment, situational awareness, public health surveillance, resource allocation. EMS data is really unique in the idea that it is so timely, it is so available as you build relationships with the data generators and the people who can use the data to make policy, procedure, process, staffing decisions, and be able to adjust the delivery of pre-hospital medical care to the needs of their community. All right, I'm going to take a breath, ask your questions. Let me check chat. Okay, perfect. All right, we're going to zero it down a little bit more into the specificity of traffic-related initiatives. Many of you are probably very familiar with the data elements collected. For those of you who are newer to utilizing EMS data, there are a lot of data elements and values within those elements that are collected that are specific to motor vehicle crashes, injuries related to an MVC, injury related to modes of micromobility. And as we look at using the data for very specific reasons as traffic safety initiatives, it's important to look at the data standard that you're working with. Whether you're analyzing your agency level data, you may have much more robust elements that can be identified and measured that are specific to MVC or to traffic safety initiatives. Same with the state. If you are a state EMS official or a state traffic safety official, understanding what's collected at the state level and at the national level helps you to better plan for what's the story that you can tell from the EMS data. Where's the information? How do I get to that information? And what can the information tell me? What's available to me to better describe MVC in your jurisdiction? At the NEMSIS TAC, we've developed what we love to call this post-crash care suite of resources. And we're going to spend a few minutes showing you some of the different things that are available to the public that are available to the states specific to traffic safety initiatives. I recognize this graphic is meant to be big, so it probably isn't really very well readable, but I threw it up here anyway, so I hope you'll forgive me. It just gives an overview of the different services or products that you can access through the NEMSIS Technical Assistance Center to help you develop insight into what's happening on the MVC issues in your jurisdiction or in your state. Post-crash care EMS response to MVC injuries. This is a monthly report. I'm going to show you guys that. There is data for MVC with alcohol and drug use indicators. There's 2 different MVC crash dashboards that I'll show you. One of those is a MVC severity dashboard. We've got a post-crash care infographic that helps to communicate just some of those high-level big interest items on traffic safety. Case definitions, if you're a researcher or if you're looking at benchmarking performance, having standardized case definitions is very helpful so that as you are evaluating or analyzing data, you're able to apply the same criteria to all the data that you're looking at so that you're able to have that consistent description of the data that you're working with. And then performance measures dashboard. So the first one I'm going to show you is our post-crash care monthly report, EMS response to MVC-related injuries. I'm actually going to show you where this is on the website. So I'm going to pull out of the presentation and I'm going to show you how to get to the MVC or the post-crash care monthly report. If you go to nemsis.org, this is just our landing page, and then scroll down. I'll go slow so it doesn't look too fast. Over here, we've got post-crash care EMS response to MVC injury. And this is updated each month, and it will show the report in a PDF that you are welcome to download. You're welcome to use this. If there is a graphic that is especially helpful to one of your programs or to a grant that you're working on or to an initiative, reach out, contact the TAC, let us help create a graphic that's more specific to you, or we're happy to provide any of these graphics in better quality if you're looking for adding them to a PowerPoint presentation. I'm not going to go through the whole thing. It really is 37 pages. There are a lot of slides that provide detailed description of the data that's collected and represented. So you've got all of that underlying information as you look at the graphs. I'm gonna come back up to the PowerPoint presentation just so that I am not flipping through that PowerPoint, or flipping through that PDF. This will be just a little bit easier to show you. Except now I'm way out. All right. So in that post-crash care monthly report, we show you trends of MVC crashes regardless of injury. We actually go back several years. One of the beautiful values of EMS data is the ability to analyze it over time. Are the incidents increasing? Is our response changing? Is the severity changing? Are these normal ebbs and flows of EMS response? So being able to look at it over time can be very valuable. This shows the enormous dip in MVC crash and in MVCs during 2020 when states asked people to stay home at the onset of COVID. This is when states started initiating stay-at-home and lockdown procedures. Lots of people were off the roads, and we saw quite a big dip in the incidence, the rate of MVC crashes. MVC patient demographics. We're able to look at patient age, race, ethnicity, gender. We're able to look at different aspects of what types of patients are being cared for most often in MVC. This can help with targeted training, making sure that your staff are trained appropriately, and adjusting some of the measures that you have locally. Severely injured patients is another marker that's available in EMS data, not just identifying the quantity of response and the quantity of patients, but how badly injured are the patients that EMS is encountering. Being able to trend that again over time helps us to understand that MVC response isn't static. We see increase in the severity of what's going on during those crashes. Again, this is the red line is 2020, so this is our COVID year. If you recall 2 slides back, we had far less crashes, so our trend line took a great big dip in 2020 for overall crashes, but the severely injured incident rates went up. We had fewer crashes, higher severity of injuries. And if you look at the years since COVID, so this is 2021 is purple, 2022 is yellow, and the brown line here is 2023, we haven't gone back down to pre-COVID rates of severe injury. So it's a great way to communicate the change post-COVID that your EMS agencies are experiencing in regards to MVC. We look at pedestrians. How often are pedestrians injured in MVC? Yeah, that yellow line that is elevated is actually last year, is 2022. That is not the COVID year. So we saw some increases, or we saw a decrease that is related to seasonality for pedestrians. But in 2022, we saw an increase in the pedestrian industry in injury. Older adults, you can stratify your data based on age groups. You can do this for pediatrics, for different age categories. You can look at this in older adults, and older adults for the purposes of this trend is 65 years and older. And you can see how those trends change over time, very specific to MVC injury. This helps to communicate that story as you are trying to identify changes in your response, your policies, your procedures, or if you're trying to establish justification for additional funding or additional training opportunities. This data can be really valuable for that. Ejections, huge increase in ejections during the COVID year. It's another great marker to be able to communicate what's happening in your area. And then this is just another visualization for ejections based on age and sex. Helps you to identify your target demographics for mitigation or for reduction strategies in MVC ejections. Some of you have access to and have used fatality analysis reporting system data, FARS data, that help to identify the fatalities that are occurring on the roadway. We've taken a few of the slides and just compared those trends over the years as compared to fatalities. And so the fatalities are in the blue. The orange is the injury, the NEMSIS injury rate, and then that gray is the severe injury rate. Now these have different, FARS and NEMSIS have different denominators, but we've placed these trends over each other so that you can see that the trends are related, that there as fatalities increase, we often see injury or severe injury increase. So you're able to tell both sides of the story when you've got the FARS data, which is specific to fatality, and then what's happening that EMS is responding to. Many of your EMS agencies don't respond or don't transport if it is a validated fatality on the scene. So there's EMS data is not a great way to describe fatalities like FARS is, but EMS data is a great way to describe the injury and the severe injury that compounds that big picture, that fills out that big picture of what's happening on the roadways for patients.
Can I interrupt again with a question, Julianne?
Yes.
Someone posted in chat here to run the motor vehicle crash report. How did you filter it? Did you use ICD-10 CM codes or other variables?
Yes. Oh, that's a great question. So in the MVC reports, we identify the inclusion criteria. We make it specific to 911 response with patient contact, and we identify the groupings. The criteria is based on ICD-10 codes for injury related to MVC. So because there is some variation in how patient injury is described at the agency level or at the field level, we created a case definition or inclusion criteria that identified the specific ICD-10 codes specific to injury that was MVC related. If Lori, if you'd be willing to throw in the chat the inclusion criteria is listed on the post-crash care report that was on that front page of NEMSIS, but inclusion criteria is also described in the companion guide for the MVC dashboard, which I'm going to show you in just a minute. And so that'll give you a more comprehensive list of the ICD-10 codes that are used to identify appropriate records. Okay, we've got three of those, the fatality, comparing the fatality trends and the injury trends. One of them's MVC versus bicycle. Let's see, the one before that was motorcycle, and then pedestrian. All right, let's come back to where I want to be. Okay. Support for grant applications. Lori's going to put in the chat the link to this. One of the resources that we've developed is many pages that Lori worked hours and hours and hours putting together for some general grant information. So we know that right now there's grants available for traffic safety initiatives that are specific to traffic safety. So we want to encourage EMS agencies, EMS regions, states to pursue any grant available to them that may help, whether it's with their resources, their staffing, their training, being able to sustain the service that they provide to their community. Grants can be a great way to fill in some of those gaps. Now, before I go into much detail here, I'm going to put out there that we clearly understand that many agencies, many states do not have the bandwidth or don't have a dedicated person that seeks grants and that works, that's a grant writer. Some states have dedicated grant writers, and if you are lucky enough to be in a state like that, ask your state office of EMS, ask around, find out if there is a specific grant writer. Sometimes your county has a grant writer, or the larger cities will have a grant writer. You have some resources that may be available to you. If you identify a grant that you want to pursue, but maybe it's your first time writing it, maybe you don't know how involved, or it may be simple, it may be difficult. Reach out to some of your resources to see if you've got some grant writers available in your jurisdictions. I'm going to give you two other resources that if you haven't connected with these two groups, this has to be number one and number two on your action items when we're done here today, is reach out to your local emergency planning committees, your LEPCs. Many LEPCs do grant support. work with your LEPC to see if they can help you maybe with information for a grant, or even just sharing maybe some successful grants that they've been a part of. Your other resource is your healthcare coalitions. So this may be called HPP in your area. It may be called Healthcare Coalition, Healthcare Preparedness Coalition. You've got healthcare coalitions all across the country. Every area has a healthcare coalition that covers their jurisdiction. And one of the things that coalitions often do is provide support for healthcare providers within their coalition in identifying or pursuing or justifying grant applications or requests for additional support. So those are two partners that, if you're a local jurisdiction, those are two great partners to reach out to and engage with. If you're an office of EMS, work with your state level LEPCs. Sometimes they've got a different acronym like a SERC, a State Emergency Response Committee or something like that. And then your healthcare coalitions are going to have a governing body that might be public health. It might be health and human services. It might even be in your offices of EMS that your healthcare coalitions reside. Great resources for help in this area. All right, we went too fast there. Grant guidance. Lori, did you put that link up there? Let's see.
Yes, that's been posted.
Okay.
In chat.
So go and check out the grant guidance, tips, tricks, resources, language. Sometimes you just need help describing something, and we've got a lot of language in that document that you can use as you fill out grant applications. There's also 2 pages on potential grant applications. I'd encourage everybody to look at the Safe Streets for All grant. And Lori, I'm putting you on the spot again, Lori. If you would get into the grant application information and put the chat for the Safe Streets for All, that one still has that one's open right now, and is a great one for agency or region. Safe Streets for All is not available on the state level at this time, but for agencies or regions or coalitions, it's a really great resource. All right, how to get to the data. We have lots of public dashboards. Anybody is welcome to go onto the NEMSIS site, look at the public dashboards. We have a public motor vehicle crash dashboard, and we have a MVC severity dashboard. There are companion guides for each of the dashboards that help you to kind of understand that inclusion criteria or the parameters of each visualization. If you get into one of these and you're like, I don't get it, or I need this, I'm looking for a specific grouping of symptoms, or I'm looking to tell this specific story, reach out to us. We're happy to help identify the data elements, what might be available, what isn't available publicly, and how to help you be able to tell that story. So please reach out when you're looking for those types of resources. So it's just a snapshot on the public MVC severity. This one's helpful if you're looking for trauma criteria and transport to trauma centers. Another great resource to get to the data is if you are a statistician or if you have access to a statistician, request the 2022 Public Release Research Dataset. This is 51 million records for 2022, submitted from over 13,000 agencies representing 54 states and territories. This is an enormous data set. This is not an Excel spreadsheet or a PDF that you can just flip through and find some cool data on. It really does require some statistical support. And if you have that resource, please reach out to us, request the data set. We will send it to you free of charge on a USB and provide lots of materials for you to be able to do your own research queries, investigate the data, pull it apart, slice it up, look at different aspects of EMS response and patient care. The EMS Data Cube is also available, and this is a public resource. It is a really extensive OLAP cube. So think of if you're familiar with using an Excel pivot table, this is a really complicated pivot table. But the ability to go in and sift through EMS data is really cool. I will warn you, though, that as you get into the data cube, you're going to think about all these other aspects that you're curious about, and you might end up finding yourself spending a lot of time in the data cube trying to look at, can I see this in EMS data? Is this available? We have the learning curve for the cube is not small. So we've provided a guide and we've provided a bunch of videos. We'll also provide one-to-one help if you are getting in there and you just need some guidance. We're happy to help you. The real value of the cube is for you to be able to go in today or tomorrow and identify, okay, can I tell this with public data? Can I get to this concept through the data? This really helps you to flesh out and develop the language or the criteria for the query that you're developing. We also offer tailored NEMSIS data sets. We have some really fantastic and talented statisticians that support our stakeholders in tailoring, customizing, cutting down parts of the data so that it's easier or more specific to the needs of the stakeholder. You can reach out and request a custom data set. We do provide some masking. The NEMSIS data the public data, we do not disclose geographic locations. Geographic specificity is limited to regions and urbanicity. So if you are wanting something that's very specific to one state or to a county or to a city, we can help you with masking the data of like states or cities or jurisdictions. But more importantly, we can connect you with the State EMS Office of EMS to access or to look at state-specific data. On our website, if Lori would be willing to put in the chat again, thank you, Lori. It's on our main page. When you go to the main page, you'll see this map. And if there's a state that you're wanting specific data for, you can click on that state, and then it'll show you the contact information for that State Office of EMS. And that's where you would need to go if you were wanting a specific zip code, county, region, city, or very state specific. You would need to go directly to that State Office of EMS, and each one has different procedures for requesting data. The other thing that I'll tell you, though, is some state offices of EMS are very short-staffed. Like a lot of offices, there's turnover, and if the State Office of EMS grants permission for you to have that data, but then they're not able to provide it to you, they can send us an email and give us permission to share that data with you on behalf of them, on behalf of that state. So we are happy to help support states in fulfilling those requests that they get if it's an approved use of their data. There is one dashboard that if you are, and I'm putting this caveat out there, if you are a state level traffic safety official, you can request access to the state level EMS response MVC dashboard. So this is that public, we showed it to you in the beginning, it's a public dashboard with all of the MVC data, but there's one that's specific to each state, and a State Office of EMS can go in and look at all of that MVC data that's specific to their state only, but it's restricted access. So we have, at the request of states, we have developed a permission for access to that dashboard only. So if you're a state traffic safety official, you can you can send us a request, and we will contact the state, and if the state approves for you to have access to state-specific traffic data from the MVC response dashboard, then we will grant you a user account for you to see that state-specific data. So that is an option available. It only applies to that one dashboard, and it only applies to state traffic safety officials. So there is some caveats with that. All right, man, we just threw lots of information at you about where that data is coming from, how it's organized, how you can access it, tools that are available to you to be able to tell the story of what MVC looks like in your jurisdiction. Are there other ways that you need support in using your EMS data, or are there specific stories, a specific initiative that you want to know or you want to be able to describe with EMS data? Feel free to, I'm gonna check the chat. Lori's been so fabulous to put links up there for you. And you're welcome to come off of chat or come off of mute if you've got a question or a specific, if you have a specific example of how you've used EMS data to petition for better resources or support or communicate the strain that your EMS agencies or that your EMS clinicians might be under. We really appreciate any best practices or questions that can help us determine how to better provide services or resources for you. So feel free to come off chat if there are any questions. I am happy to take those. There are lots of ways to connect with NEMSIS and to follow notices or Lori's really great about posting in our resources about grant opportunities that come available or that are being promoted. You're welcome to follow any of those or join the Google group for notifications. I'm going to put up some contact information. You're welcome to reach out directly to the TAC at the support email address. My email address is up there, Lori Lundy, on the call that she's been so helpful. Lori's specialty is state support. So you are welcome to reach out to Lori with questions that are specific to states, state offices of EMS, state level data. And then I also put up Jennifer Correa's information in or her contact information here too as well. Jennifer's specialty is software developers, vendors, EMS PCR software. She has extensive history with that industry. So if you have questions that are specific to data elements that are being presented in a software product, we have really terrific. Okay, let me stop sharing and then I'm gonna do one more plug. Okay. All right, hopefully I've stopped sharing. Here's my last plug. Reach out to your software vendor. So your field level product, what your clinicians, what your agencies are using in the field to document their PCRs, what the states are using for software to collect those field level PCRs and then to send to NEMSIS. These software developers, these software vendors are extraordinarily involved in understanding the data collection process, the rules around collecting and submitting and sharing. They are very involved in developing reports and products that are helpful to the agency, a region, to the state. If you are looking for some specific measurement, please always consider your EMS software vendors as a partner to you. They are very engaged in the process. We work closely with them, and they're Many of the vendors are committed to providing terrific reports, tables, or visualizations, or helping you to tailor your PCR to what is specific to the needs of your community. So they're a terrific resource. So please reach out to your vendors as well. All right, Lori threw up email addresses in there in the chat. Hopefully you know how to get a hold of us. You're welcome to a PDF of this presentation, or if there are slides that you need for a presentation that you're doing somewhere else, we really are happy to help support your efforts in any way that we can. So please reach out, let us know what we can do to help. Let us help connect you to other people who may be a great resource to you as you look at using EMS data for your traffic safety initiatives. And, we focused really tightly on MVC related, but, there's a lot of information. EMS does a lot more than traffic calls. So let us know how we can help you in any of those ways that you can utilize EMS data for improving patient care and field care. Thank you. Thanks so much, everyone. It's a lot of information. I hope some of it was helpful, and we look forward to hearing about all the great ways that you use EMS data in your states and your agencies. Thanks, everyone. Have a great day.